Hello and welcome. I'm Scott Dennis.
And I'm Haley Wilgus. Thank you for joining us tonight. Nurses and other medical workers held a protest in Venice today. Their goal is to raise awareness about the need for adequate nursing staff in hospitals.
The National Nurses Organizing Committee says Venice Hospital's new CEO has a track record of not having enough nurses on staff, and they warn that could be a huge problem. ABC 7's Christopher Bradley has more from Venice.
Local medical workers took to the streets Wednesday to push their message about concerns related to the new CEO, Bob Moore, at Venice Regional.
We're people that our parents are seeking care at this facility, and we want to make sure they get the best care possible.
Their signs read "Patients before profits." Protesters allege Venice Regional Bayfront Health's new CEO, Bob Moore, did not have enough nurses to fully staff his former hospital, Monroe Regional Medical Center in Ocala.
They objected to that, basically, and 3 nurses were actually fired for refusing to take on this overload of patients.
On behalf of Bob Moore, regarding those allegations, Venice Regional sent a statement saying those 3 nurses at Monroe Regional, quote, failed to report to work without notice. The statement goes on to say that anyone who fails to report without notice poses a challenge to staffing.
We want to make the community aware of this and also make sure that the Board of Trustees of the hospital here is aware of this.
The National Nurses Organizing Committee sent a letter to the hospital chairman where, after addressing him as a female, they asked him to discuss the matter more in depth. We're told no such conversation has happened yet. Barbara Logan says she's a heart patient and fears what may come to her if not enough nurses are assigned to her.
If I'm in there recovering from heart surgery, I want my nurses to be there if I need them. And I feel like if nurses have twice as many people they're in charge of, that might not be happening for Barbara.
When protesters were asked if anyone had evidence to suggest there was a shortage of nursing staff at Venice Regional since Moore took over, no one could produce any. For their part, the hospital says nursing plans are based on the number of patients and their specific needs. They also say any staff member that has a concern should speak up.
That was ABC 7's Christopher Brantley reporting. The end of the statement reads as follows. It is unfortunate that the California Nurses Union and its National Nurses Organizing Committee is distorting the facts about another hospital in an attempt to gain publicity and disrupt our momentum.